Well, good morning. I'm Jim Tripp. I'm from Menominee. Laura is from Lake Geneva. We're both volunteers with Senior Medicare Patrol. And the Senior Medicare Patrol, as it indicates up here, is all about helping people detect and avoid and then report fraud. So we're going to talk a little bit about the kind of fraud that is most common, some ways that you can protect yourself, and how to report things when they almost inevitably go south on you. One of the things that continues to surprise me a little bit as I go around the state is how many times people are victims of scam or fraud and don't tell anybody. So it's really important that if you have a suspicion that something is wrong with your Medicare coverage, or you've been inaccurately or incorrectly billed, or whatever, please call somebody. And you can always start by calling your healthcare provider and asking them to explain the bill. That's a good place to start. But if you're at a loss as to who to talk to, call Senior Medicare Patrol. Now, I want to emphasize one other thing about that phone number. It's a helpline. It's not a hotline. So if you call, you are likely to get a recording. If you've got a true full-blown emergency, call your medical provider or the police or somebody. But if you simply need help getting through what you think is a problem, either a mistake or an error or fraud, and you call Senior Medicare Patrol and you get a recording, you will get a return call within about 12 to 24 hours. And the beauty of our service is threefold. Number one, we will always get back to you. Number two, we're a nonprofit organization. We're never going to try to sell you anything. We're not going to send you anything. We're not going to send you emails unless you ask for it. And number three, it's confidential. So you don't ever have to worry about your name being used as some kind of an example or anything like that. Now, I do have to caution you, occasionally the kinds of things you might have to report are criminal activity, and at that point, the person on the phone is going to recommend that you call the police, you call law enforcement, and at that point, then you've got a decision to make about how public you want to be. But these are important things to recall. A couple of things before I get into the presentation itself. One of them is our poster over there. This is the open enrollment period for Medicare. So you're going to get advertising flyers in the mail. You're going to get emails, texts, all that stuff. Depends on how much time you spend on electronics. But it comes in by the bushel. Almost all of these are legitimate companies wanting to sell you something, and that's the key part. They want to sell you something. There's nothing wrong with that. What they want to sell you may be a very good product, might be perfect for you, but resist the lure of celebrity commercials, and there are a couple of things. I don't know how easily you can see this. The phone numbers that they give you, that's not Medicare. It's a company that wants to sell you something. The benefits that they're talking about may not be available. Every state regulates the application and the administration of Medicare, and different states have different rules. As of the 1st of November of this year, the state of Wisconsin will have uniform Medicare coverage for the first time. And all 72 counties will have the same companies covering the people in those counties. The coverage itself may not be exactly the same, but at least you get the same companies. These providers may not be available in your area, and you might not be eligible for those benefits anyway. One of the common scams now is Medicare recipients. Did you know that there's a $1,780 grocery card available? It's not. Laura and I were talking a little bit ago, and I was giving her heck about answering the phone and talking to somebody. The other day, I deliberately clicked on a thing on my computer that I knew was a scam because I wanted to see how far I could trace the company. It was out of Vilnius, Lithuania.
Oh my goodness.
In no way in the world did they have anything to do with Medicare. In no way in the world was it legitimate. Now, one of the things that you can do to kind of protect yourself is to pay attention to where things come from. And again, I will cite this. I got this in the mail just the other day, and the key is what's on the envelope, or actually not on the envelope. There is no return address on here. Throw it away. Goes right in the recycling, because there's no legitimate company that is going to send you anything without a return address. This is a scam, and as a matter of fact, it has nothing to do with Medicare, but it's got some information on here that's accurate about my mortgage. That's what they use to scare you. A lot of this stuff is public knowledge. It's public record. They get that stuff, they use it to scare you, and when you're afraid, you tend to make decisions that maybe aren't the best. So anyway, back to the packet. You also have a pen in that packet, and at this point, most of the people in the audience say, well, this crummy pen doesn't work. Well, the reason that crummy pen doesn't work is it's got a little red tip on it, on the little red plastic tip. So at this point, I say, if you're going to use the pen, take the little red plastic tip off, put it in your envelope. Otherwise, later today, some sharp-eyed custodian is going to come around here and say, what in the heck are all these little red things doing all over my floor? Okay? So anyway, that's... there's a healthcare tracker in there. We'll talk about those a little bit. There's a copy of our newsletter in there. And if you're interested in that newsletter, it's very easy to subscribe. You can subscribe, get it by mail, or you can get it in your inbox as an email. Very easy to do by calling them up or going to the website. There's a fraud alert in there. I just got one in the mail the other day because I'm on the list. And the fraud alerts tend to address things that are commonly happening in Wisconsin currently. There's a card in there that says, what does Medicare do? All these things have our phone number on there. There's a one-page blurb about when to call SMP. And the important thing is, if you think that there's been a problem with your Medicare, give us a call and we can help you out. All right, let's get into the presentation a little bit. Medicare fraud, important things to know. We're going to talk about SMP a little bit. We're going to talk about Medicare fraud a little bit. We're going to talk about what you can do, and I've covered those already, and then some of the available resources. What is SMP? We're federally funded. We operate on a grant that's administered by the Greater Wisconsin Agency on Aging Resources, which people say GWAR, which I just doesn't work in my mouth at all. We're volunteer focused. As I indicated, Laura and I are both volunteers, and these sources are free, confidential services and resources. Here's our mission. We want to help people, both Medicare recipients and the people who love them and care for them, to be able to detect when fraud is an issue, and then report those things. And the reporting part is really important. You know, it's interesting. Well, Medicare processes about 5 million claims a day.
Wow.
So if I'm a doctor and I accidentally misreport a visit, and I code it as a half an hour visit instead of 15 minutes, and nobody says anything, maybe I'm tempted to do that regularly, and nobody says anything. And now we've got abuse. And now, since the doctor getting away with this, maybe it goes beyond that. You have to report things like this to stop them. Outreach, counseling, and education. We do these kinds of presentations. We staff booths and tables at health fairs and elder events. And we've got a hotline, or a helpline here. I just got done saying it wasn't a hotline. We've got a helpline. And we've got trained individuals who will take your call and help you through processing the issue that you're dealing with. And it's a toll-free call, 888-818-2611. And we've got actually, our main office is in Madison, but we have people answering the phone all the way from the Milwaukee area up to Ashland. So who you get, could be anybody, but whoever you get has been trained and is knowledgeable and can help you through those problems. Some of our volunteers, there's a man named Doug Wallach staffing a booth, and again, these are the kinds of things that we do. We do have a sign-up sheet here. If you're interested in volunteering, we can always use new volunteers. Why do we need an SMP program? Medicare fraud, abuse, and error. You notice it says $1 billion industry, billion in red letters. Doesn't say how many billion. On an annual basis, $60 to $100 billion a year. When I first heard this number, my first thought was, I don't think any program can sustain a $60 billion a year loss to fraud. I just don't think it's sustainable. Now, I'm on Medicare, and I'm going to live another 50 years. At this point, I wait for the laughter. I want Medicare to be around 50 years from now. Seriously, though, I've got friends that are going to be on Medicare 50. My children will be on Medicare 50 years from now. If it weren't for Medicare, my wife and I would have a very difficult time paying for health care. Very difficult. And we're not poor, and we're well enough off. There would be lots of people, and I can think of a few right offhand, that would have no health care whatsoever. We can't afford to lose Medicare. We can't afford to keep on a $60 billion a year loss. Thus, I do what I do, and we're asking folks to do what they can do to prevent those things. Well, think it doesn't happen in Wisconsin. Actually, Wisconsin in the Midwest is kind of a hotbed for fraud and scams. And there are several proposals for why that might be, and I think they have some truth to them. One of the answers to that is that people in the Midwest tend to be more trusting, a little more open, maybe more polite. When I was a kid, we had one phone in our house, and it hung on the wall in the hallway right next to the kitchen. And when a call came in, everybody in the family got to participate. Okay? As well as half the people in the neighborhood, because we were on a party line. Okay? So my parents taught me to answer the phone with, "Hello, this is the Tripps. My father, Robert, is not at home right now. My mother, Alice, is here. Would you like to speak to her? My name is James. My mother-in-law's maiden name was, name of my first pet was." Well, we were trained to give people information that was polite. This presentation is going to tell you to do exactly the opposite. There is no need to be polite on the phone. If somebody calls you that you don't know, Laura, don't talk to them. Merely answering the phone gives them another tiny bit of information. And there's a ton of information available on all of us out there in the ether. My wife got an email several years ago now that threatened to close us down because they had all our passwords if we didn't send a bunch of cryptocurrency. And they had, her mother's name is, I'm going to tell you all my secrets, huh? My wife's mother's name is Hyacinth, and so my wife uses that as part of her password for a lot of things. They knew that. How did they know that? It's public record, and they guessed. At the time, fortunately, I was in a situation where we had some really bright tech people I could call. I called them up. They said, just forget it. They're just fishing. But what was my reaction when that email came in?
Shock.
Scared me. It scared me. And when you're afraid, you're likely to do something that you ought not do. So these things happen in Wisconsin maybe at a higher rate than they do on the coast. Recently in Wisconsin, there have been scams about new Medicare cards. There are no new Medicare cards. There are no laminated cards, none with chips, none with a lanyard, there are none. If for some reason or other you need a new Medicare card, or a new number, for heaven forbid your number gets out there, you call Medicare, deal with them directly, and they'll take care of it. Don't take any of these calls. Another one is durable medical equipment, knee braces, walkers, wrist braces, back, all kinds of things. What the scammers are very often doing, and this is why I say don't answer the phone. If they call your number and you answer, they automatically know they've got a live person connected with this number. They look up your address, and now they send you stuff. They might be sending you stuff that's charged to Medicare numbers that they stole from who knows where. Okay? But if you get the stuff and you keep it, now you have to demonstrate that you didn't order it. Under the worst circumstances, they call you up and they say, is this Alice? Yes, it is. Okay, they've got a recording of you saying yes now. Okay, so don't ever say yes. They send you the stuff, and at some point you got a closet full of braces. Maybe have been charged to half a dozen or 20 Medicare numbers. Maybe it's to you. Any way you slice it, this is fraud, and you have to report it. We were in Prairie du Chien this summer. I think that's where it was, where a lady told us that her father had a closet full of braces. You got to report that stuff. Otherwise, it just keeps going and going. Another one is genetic testing scams. Medicare does not pay for genetic testing unless specifically ordered by a doctor under quite rigid conditions. Otherwise, they're not paying for genetic testing. If you're interested in genetic testing, there are actually, I know of two, I actually participate in two independent studies that are doing genetic testing and gathering the information to use as a database. One is through the Veterans Administration, the other is through Mayo Health Services. And the chances are that if you were interested in doing something like that, you probably could find a place. But don't fall for those phone scams. The new Medicare card scam, we looked at that already. They're not issuing. Somebody calls you about this, hang up. These are frauds. There's nothing in there that's going to help you. Same way with the braces, the buzzwords free. Verify your Medicare number. A lot of the scams will use that. They'll say, okay, we're going to send you a new card. You just verify your number and we'll send it to you. Now, what I used to do before I learned better is I say, no, you give me the number and I'll verify it. But no, I don't. Don't talk to them. Don't say anything. I talked to a gentleman who works for the Wisconsin Department of Justice several weeks ago. Well, actually, it was last spring, I think. Anyway, I said to him, I wanted to talk to him about artificial intelligence because of the potential it has for really complicating these things. And what I expected him to tell me was, no, they haven't had any artificial intelligence problems yet. You know what he did tell me? Dealt with 4 cases in the last month. He said, if they can record your voice for as little as, I think he might have said 10 or 12 seconds or 10 or 12 words, they've got enough information then that they can generate a conversation in your voice that is very difficult for anybody to tell that it's not you. And he had dealt at that time with 4 of them already. So artificial intelligence. So don't be verifying your Medicare card. Don't do any of those things. I like your response. Read scripture to them. They can use it. Don't do it.
Don't do it. You're right.
About once a month we get SMP News. And in there they talk about some of the cases that have gone to trial and the people have been prosecuted. And it doesn't, well, certainly not enough of them, but there are people that are spending lots of time in jail and paying hefty fines. But you are absolutely right. In most cases, these people will never be caught. And actually, that's another aspect of what makes Medicare fraud so difficult. Medicare pays claims and will only detect the fraud after the fact in most cases. So in most cases, by the time they go after somebody, they've already collected a whole lot of money. Almost impossible to get back, although there was one news article recently where they sold some guy's mansion for $8.7 million and used that to pay back part of what he stole from Medicare. But otherwise, you're right, and I hope there's a special place for those people. It's hard, and I get this reaction quite a bit also. People say, these scammers and fraudsters, a lot of them are really smart about what they do. Why don't they get honest work? We need people like that. All right, so I'm not going to spend. It's kind of depressing sometimes when you think about those folks.
Easy money for them.
It is easy money. Suggestion: if you're thinking about knee braces, back braces, any of those things, call your Medicare provider or your medical provider. Call those people. Work with them. One of my messages is you instigate the conversation. You call the doctor. You call Medicare, and then make sure you've got the right place. I've got a few slides at the end that talk about how you can kind of protect yourself online a little bit if you're doing that. These genetic testing scams, they'll tell you that they're going to do genetic testing for cancer and things, and they can actually. I used to teach asbestos courses, and in asbestos work, lung disease is a serious issue, and I retired from that about 10 years ago, but one of the things that was just in development then is they had identified, I think, 6 or 8 genetic markers that were associated with lung cancer. And they determined that if you had 5 or more of those, your chances of getting lung cancer were significantly higher than most. And of course, for asbestos workers, that's an important factor. But again, Medicare is not going to pay for this unless the doctor orders it specifically within a certain set of fairly rigorous guidelines. What can you do? Protect yourself, detect when fraud or errors have happened, and then report. Protecting yourself. Treat your Medicare just like your Social Security and your bank numbers. Don't give out that Medicare number. They also advise don't carry your Medicare card with you unless you're going to need it. And the only time you need it is when you go to a medical provider. If they don't already have it, then you're going to need to provide that. Don't give out your number to strangers. Medicare is not going to call you to ask for your Medicare number. Don't be afraid to hang up on people. Not only don't be afraid, take joy in it. Take joy. Don't say anything. Just hang up. Don't be afraid to hang up on people asking you personal information. Some robocall, I like this one too, and this happens on texting and emails. If you no longer want to receive these texts, click here. Guess what?
Yeah. Just let them know that you're there.
If you don't answer or respond, you will ultimately receive fewer of the calls. Now, not enough so you're going to notice. You're still going to get plenty of them. But if you do respond, you can guarantee that the number of contacts that you get are going to increase. So don't respond to any of those things. How to reduce the number of phone calls? Unfortunately, no quick fix. Do you have a landline?
I do.
Okay. If you have a landline, you are susceptible to more calls than if you have a cell phone. I spent a few days at my daughter and son-in-law's house a couple months ago I didn't take care of. I got 2 teenage grandchildren. But they've got a landline because their kids now have cell phone, but they needed it. That phone rings probably 6 times a day. They never answer that phone. I said, why don't you just get rid of it? Oh, I don't know. The kids still, if they do get in trouble, call so. But if you've got a landline, you're going to get more calls. You can register for the do not call list. By the way, that number and that website is in the back page of the healthcare tracker. That information is there. Contact your phone carrier to see if there are blocking services. Some carriers are better about that than others. And whatever the case, if you don't know who's calling, don't answer the phone. And if you do answer the phone and you don't know who's on the other end, hang up. Don't ever give out personal information. Detect fraud and abuse. The healthcare tracker that we have in that packet is a good way to keep track of what happens at each doctor appointment. Then, when you get your medical or your Medicare summary notice, which will come every quarter in any quarter that you've had services billed, you'll get it in a quarter, and on that Medicare summary notice is a list of things that Medicare has paid for. When I was first on Medicare, I looked at that, and right up on the right-hand column towards the top in bold letters, it says, "This is not a bill." Pitch that baby over my shoulder. That's gone. If it's not a bill, what do I care? I didn't realize at the time that what that statement is a recording of what Medicare has already paid for on my behalf. It's my responsibility to double check, did I actually receive those services? And that's where that Medicare or that healthcare tracker can really be handy. If you take that to the doctor, fill it out. I'm going to the doctor next week. Actually, I've got my annual Medicare physical, and then I'm going to see a cardiologist again next. And I'm going to have some tests. So I'm going to write all that stuff down, and when my statement comes in, they better match. If they don't match, I need to call my medical provider and say, I've got services here I don't understand, okay? And if you can't get satisfaction, if that doesn't work, if you're still up in the air, that's a good time to call Senior Medicare Patrol. Say, hey, I've got some issues here that I don't understand. Double billing, incorrect coding, services that were not ordered by your doctor. Those things will show up. And it's important, again, that as individuals, we kind of keep track of that stuff. Medicare is not going to do it, okay? Use your healthcare tracker. We talked about that a little bit already. And it's fairly easy to write that stuff in that healthcare tracker. And frankly, for me, who can't write, I have the nurse do it. And the advantage there is they know how to spell stuff. Well, there's all kinds of junk that they do. I don't know how to spell that stuff. Jiminy. If you're on an Advantage plan, you're not going to get that Medicare summary notice, but you're going to get an EOB. It's called an explanation of benefits. And a lot of those come out monthly. Same thing. They're going to tell you what your insurance company was billed for and paid for on your behalf. Now, don't get confused, because how does your insurance company get paid for that? They pay the bill. Medicare pays them at a rate of 104% of cost. That's what makes it worthwhile for those Advantage plans to operate. Okay? Yes. The question is about Advantage plans and whether they're appropriate. And I'm not. Let me put it this way. Advantage plans are the appropriate route for some people, but not everyone. An Advantage plan basically does a couple of things. It usually covers more than your standard Part A and B and supplemental plans. And it covers more because you are limited on your medical providers. You have to go to their network, okay? So that saves the insurance company some money. The other thing is that Advantage plans have a rate of refusal to pay claims about 20% higher than standard insurance plans that offer Medicare supplemental. So they refuse claims more often. You have to go to their network. Now, that doesn't mean that they're bad plans, because frankly, they work very well for a lot of people. Frankly, that's a great lead-in back to don't buy insurance from a commercial. Your best bet is, if you're getting on Medicare or just starting or considering changing your Medicare coverage, call your local ADRC, your Aging and Disability Resource Center in the county, or call your elder benefits specialist directly. They work either with or for the ADRC. Or call the state health insurance program. It's called SHIP. And that number is also in the back of that healthcare tracker. That's a state agency that is specifically designed to help people sort through the options. Now, the advantage with those three, ADRC, Elder Benefits Specialist, and SHIP, is that they work for the government. They have your best interest at heart. They're not selling you anything. The best insurance person in the world can advise you on the best program for you, but always remember that the bottom line is, and an insurance salesman that sells you a product is probably going to get an Advantage plan, is probably going to get a commission that first year of about $500 or $600. That's a nice little paycheck for a day. And every year you renew, they will get a commission that runs about $300. So nothing wrong with that. This is America. This is business. We buy and sell things to each other. Perfectly legitimate. But if you're going to get advice on what's best for you, I'm not going to go to a Chevy dealer to say, what kind of a car should I buy? Okay? So go to one of those other agencies. There are plenty of them around, and they offer you advice that's going to be best for you, not necessarily best for the company. Healthcare trackers, all this stuff can be available online if you're good with a computer. By the way, I want you to pay some attention to the URLs, the addresses for websites. You notice that's .org. That usually means it's a nonprofit. I didn't realize this until I did some research just recently, but the company that keeps track of website address names, it used to be the United States government did that. They sold that to a private company in 2019, I believe. And now you can be a commercial enterprise and get an ORG website address. So you need to be a little bit more cautious than you used to be, okay? But we'll talk about that a little bit at the end. Step 3, and again, this in my mind at least, this is why I do this. We can't sustain the $60 billion, and the only way we're going to get a handle on it is if people speak up. We need people to speak up. Start by calling your provider. Get your information together. If at any point you're confused, call SMP. We've got trained people that will help you through the process. And again, free and confidential. You're never going to get a call from us saying that we want you to do something unless it's in a response to your request. So SMP's not going to call you unless you ask us to. And that's actually a good rule of thumb for any. Your doctor's probably not going to call you unless you've got an agreement where you're going to talk to them. When to reach out. If you accidentally shared your Medicare number, and it happens. People accidentally share their Social Security number. People accidentally share all kinds of stuff. It happens. If you received things that you didn't order, the best thing to do if you get a shipment of stuff you didn't order is to refuse delivery. The second best thing is to send it back to the sender immediately, but often that'll cost you money. The third best thing is to at least let somebody know, because once you accept delivery of stuff you didn't order, it gets difficult then to prove that you didn't order. And it's possible that you wind up paying for it. Report suspicious phone calls related to Medicare. Have questions about a mailing or an ad? Report that. They're probably tired of me. I'm addicted to solitaire on my phone. And with solitaire, with every new game, I get another ad. And I'm constantly sending those to Medicare, or to SMP. Here's an ad that says this. But report those things. And if you're interested in a volunteer opportunity, we've got a place for you, that's for sure. Yes?
When you said refuse a package, like, do they put their return address on it so we know we don't want it? Like, how do you know it's not really something?
Yeah, that's a judgment you have to make. And the first question I always ask myself, of course, my wife and I, both of us order junk from Amazon all the time. We're always getting, and my wife is kind of a crafter, so she does crafts at the local nursing home, and so we get stuff from all over the place. But occasionally something will show up at the door and we'll look at each other and neither one of us has any idea what that happened. Now, usually by the time we see it, the delivery guy is gone.
Gone, yes.
Yeah. But if all the stars are aligned and you got a package in your hand and the delivery man is there and you didn't order it, you say, I did not order this, I'm not taking it. Here, take it back. And they will.
But I mean, do the scammers put a return address on it?
Probably not one that's legitimate. They may have a return address on it. Interesting, I got an email, I guess it was a couple of months ago, or maybe it was a text message. I can't remember. Anyway, what it was, here's your order, $989 for a pistol from a gun shop in Texas, charged to my PayPal account. None of that was real, okay? The first thing I did is I went to my PayPal account and logged in to see if there was any activity. There was not. I went to my credit card to see if there was any activity there. There was not. And I knew that that would be the case, but I wanted to double check, and then I simply deleted those messages. I got 3 more of them, and my wife got 3 or 4. And I was talking to somebody, Laura, do you remember somebody else was saying they got the same thing. If you can refuse delivery or acceptance of that stuff, that's great. If you can't, your next best thing is to repackage it and ship it back, but that's likely to cost you some money. And then document those things. One good thing about the new cell phones is they all have cameras and it's real easy to take pictures. I just happened to be walking up my sidewalk the other day when the FedEx guy was there. He had a package, and I had the package in my hand. He took my picture with my package, so there's delivery. Okay, he was impressed. Anyway, but that's not always possible. So you do what's possible, and if that's not enough, you do the next best thing.
I get messages, and these are legit. Your package is arriving today from Amazon.
Mhm.
And I do have a package coming from Amazon today. One day there was one on there that said, we can't deliver
Yes.
because of your address or something. And it's like, I knew I had nothing coming. I just ignored it.
One of the things, when I showed you that envelope earlier with no return address, one of the things that I ask people to do is look at where the message is coming from, look at the message itself. If something doesn't seem right, it's not. And one of my favorite stories is I got a text a few months ago that was supposedly from the United States Postal Service. And I have an account with the USPS. Every morning I get an email, tells me what's coming in the mail, and I stop my mail line. Anyway, so I wasn't surprised. So I get this, and it says, we've got a package, but we can't deliver it because of this. And I'm thinking, no, that's right. So I read down the message, and at the bottom, the very last line of the message, it said, and I quote, "The United States Postal Service hopes you have a wonderful day." All right. Now, I love the post office.
Yeah.
My best friend is a retired postal worker, but frankly, they don't give a hoot whether I have a nice day or not. All right. You look at stuff like that, you say, this is not right. Delete. Period. End of story. And there are often, not always, often clues like that that will tell you that this is not a legitimate, this is I don't know what they're doing, but it's not right. Not only that, but if I deleted that and it was accidentally was a legitimate, my postal carrier would bang on my door and say, hey. Okay. So, how to contact SMP? There's our toll-free line, 888-818-2611. Our website address, we're also on Facebook. I don't do Facebook, but some people do. And our email address. And actually, if you were to go to the website and wanted to send us an email, you can contact directly from there. Now, I want to spend just a few minutes talking about these website addresses and things to look for, because in a lot of cases, I find that people aren't very careful about where they go. Okay? So, this is an example of the SMP website. And if you look up at that top line up there, right under Wisconsin Senior Medicare Patrol, that was what you typed in. And then you'll see a bar there next to the house symbol. It's got a padlock, and the padlock's locked. And the address next to it says HTTPS. That stands for, you ready for this? Nobody cares or wants to know. Hypertext Transfer Protocols. And the S means secure. That means that if things are working properly, only you and the recipient will share information that you might put on there. If that padlock is open and or there is no S, then be aware that everything you put onto that is open to the public. Anybody that can access your browser or router can get that information. So pay attention to that S. Also then, you'll see the address of smpwisconsin.org. .org usually means a nonprofit. Not always, but about 99% of the time. If you see a .org, you know that it's probably not somebody that wants to sell you something. So look at that website address. Look at the S. Okay? If it says S, it's secure. And this is particularly important if you're going to buy something using your credit card, or if you're going to contact your bank or anything like that. If that website does not have the S, if that padlock is open, don't share information unless you don't care who sees it. I stayed at the Cobblestone last night. I used their website. That's not secure. Everything that I did this morning and all the maps I looked at, that's all open to the public. Okay? Here's another thing. This is a screenshot of my computer. And up there in the Google search line, I typed in Medicare Part A and B. Okay? Half a second later, I got 256 million results. Okay? Now, look at what I got. And the first thing that it says is sponsored. You know what that means? That means they paid to have that address there. So the first thing you get, somebody paid for. And this is healthcare.com. Com stands for commercial. They want to sell you something. If you want information about Medicare, maybe that's not the best place to look. Enroll in Medicare Part A and B, check your eligibility. Now, I'm going to tell you something. You are not going to enroll in Parts A and B through healthcare.com. Well, I shouldn't say that. Actually, you can. But you're going to do it through their commercial product. It might be the best insurance policy on earth. It might be perfect for you. It might be cheap as you can get. But again, if I want to know the best car to buy, I'm not going to the Ford dealer. Okay? Look at that URL. If it ends with .com, it means it's a commercial site. They want to sell you something. So be a little cautious about that. Here's another screenshot from my computer. I typed in simply Medicare. And in this case, I got Medicare.gov. That's a government site. Okay? Much as you can trust the government, you can trust that site. And it says, the first one, welcome to Medicare. Medicare Part B insulin coverage. You go to that site, you've got a government site. It's going to be secure. They're going to give you basic information about Medicare. They're not going to try to sell you anything. Okay? It's a government site. Oh, and that's it. And look at that. We got 5 minutes. Got 5 minutes to go. Seriously, if I could convince people to do just two things. Number one would be don't answer the phone, don't respond, don't open emails, don't open text messages. Just ignore that stuff. Delete it, get rid of it. Don't talk to them. As funny as I think some of these things are, and reading scripture to them, I like that a lot. I was up north a few weeks ago, and a guy said his wife passed away a few years ago, and she still gets calls. So next to his favorite easy chair is the phone and his numbers. So when he gets a call asking for his wife, he always says, she's not here right now. Can I take a message? And they'll say, well, can you have her call me? And he'll say, do you want the number where she can be reached? And they'll say, of course, yes. And then he gives them the sheriff's number. Okay. Gives them the number of the sheriff's. I laughed. I thought, that is really funny. Don't do that anymore. Okay. Seriously. I used to get, well, my trick was that, you know, when people offered to call me up and wanted to sell me something, I'd say, oh, good. Nobody wants to do business with me since I got out of jail. Okay. That's a lot of fun. Don't do that. Okay. Don't do that stuff anymore. If you're an old Seinfeld fan, Seinfeld answered the phone and he said, why don't you give me your number and I'll call you back later. And he said, oh, you don't like being called at home? Well, okay, that's funny too. Don't do that. Don't answer the phone. Don't respond. Don't talk to them. In this age of artificial intelligence, it really, don't let it scare you, but it can be pretty intimidating if you think that a few words on the phone is enough to get something like that. And the scammers are good. One of the things I enjoy about this job is I hear 10 million stories. I was talking to a police officer, and I can't remember, it might have been Beaver Dam or somewhere. Anyway, he was doing a presentation as well and talking to people about fraud, and he said, I'll tell you a story. My father-in-law got taken for $1,200 just recently. And he said, you'll never guess what kind of a scam it was. The caller called his father-in-law, who he said is 72, bright, nothing wrong with him at all. And then the cop said, and this is my favorite line, he said, and he knows what I do during the day. He got called by a scammer pretending to be the police that said his grandson was in trouble and needed money, and before you know it, he had sent him $1,200. Why did he do that? And here's a bright guy. He's totally alert. He's got a son on the police force, son-in-law on the police force. Why did he do that? Because the scammers are really good at what they do. And they either scare you or threaten you or intimidate you in some way so that you make a decision that's really not good for you. But they do it, and they're successful because they're good at it. So don't think you can outsmart them, much as we'd like to think that. Just don't engage. That's the best thing. So here's the thing. There's a really a lot of information about every individual that's available to the public.
That's true.
A lot of public record.
Yeah.
If you use social media of any kind, that's magnified 1,000-fold.
You're talking about Facebook and stuff.
I'm talking
Yeah.
about Facebook and anything else,
Twitter.
LinkedIn and Twitter and no, and even if you don't do that, and my wife and I rarely, there's just an awful lot of information available. Anytime you pick up the phone or respond in any way, you've just given them one more little piece of information. If nothing else, you pick up the phone, they now have a phone number that they can link to a specific individual. And using reverse number data, which you can buy on the web for about $20, they can find your address. I've noticed in the past couple of months, it probably has been going on longer, that my wife or I will get emails from an email address that we've recognized that is not that person. Or I got one the other day from Amazon Fulfillment Center. And what it was from an individual who used, actually it did some kind of magical trick where they forwarded so that it looked like it came from Amazon, and it was actually from an individual. One way to be a little bit cautious about that is if you get an email, right below the last character in the email is a little tiny gray triangle. And if you click on that little tiny gray triangle, it will give you the complete history of the email address. So if it's a forwarded address, it'll show you where it came from and who forwarded it. And try that next time you get an email from anywhere. So if it's a forwarded message, or if it's going to a group of people, or if it came from a third party, or it'll give you that email history, and then you know a little bit more about where it came from. But thanks to Maureen for inviting us, and thanks to the library for hosting.